Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode. We are going to chat about the forelimb stay apparatus, which is very important for stability of the forelimb, as it keeps all of those limb bones in their position for stabilization. So how are you today, Soph?
Very well. It's an interesting concept, especially because the stay apparatus is, I think, more recognized in the hind limb, but they also have one in the forelimb, and there's a lot of issues that can arise. So yeah, the stay apparatus allows the horse to sleep standing up, but also allows that front limb to be like a pogo stick when landing a jump. So, I mean, there's so much force coming down and they don't buckle, they shouldn't buckle, and it also allows the limb to be able to be locked when it's in a full weight bearing position.
Yeah, it's a super important for safety in terms of riding. And this was a listener request. We had a listener request to discuss the wobble of the forelimb when a horse is standing. So that promoted us to talk about it today. I just want to make a little segue. This particular episode is supported by the whole podcast is supported by Dr. Shelley Appleton from Calm, Willing, Confident Horses. Shelley offers clear, grounded guidance that helps people get unstuck using a whole horse view that supports behavior, learning, and well-being through programs, resources, and a membership community. So you can use the code Raquel10 in capitals at checkout on her website to receive a 10% discount off her programs and resources. And to find out more, you go to www.calmwillingconfidenthorses.com.au. So now we'll jump in to chat about the stay apparatus. So there's a number of important anatomical structures that are a part of this stay apparatus. So it's not like just the forelimb, it's like specific structures that keep the forelimb standing and yeah, that are really integral for that. So what are some of those structures, especially in the upper part of the limb?
Part of the limb. So there are, so this is also a combination of muscles, but also like the way that the bones lock and then the tendons that go all the way down the leg. So if you think about the muscles at the top, you've got the serratus ventralis thoracis, which connects the forelimb to the ribs. You've got the triceps muscle. You've got the biceps brachii, including the lacertus fibrosus, which is a big tendon coming down the front of the forelimb, just below the shoulder. There's also the extensors of the limb, so the muscles that go from the top at the front of the limb down to the front at the bottom. The flexors, which are the same except they're going down the back of the limb. And then you've also got the check ligaments, which are in the limb. They connect the structures like the suspensory. No, not the suspensory, my brain's. Thank you. SSS. Superficial digital flexor. So they're attachments between the bone and the tendon, which is interesting because ligaments usually only go from bone to bone, but this is an instance where they go from tendon to bone. So it's an important and interesting structure in the body. And then there's also the fascia, and the balance of that fascial tension throughout the body is very important. So you've got the structures, we're talking about structures running down the front of the leg and the back of the leg, but also the inside side of the leg and the outside side of the leg. So it's almost like multiple directions hold a level of tension that allow the stay apparatus structures to lock in the elbow and support the front of the shoulder, so as well as lock the the carpus or the knee so that the forelimb stays in that pogo stick formation.
Yeah, it's a really important, and like I know under dissection, Sharon talks about with the biceps brachii, which is the one that runs over the shoulder. You know, like you mentioned, in the hind limb, we talk about the patella locking mechanism as part of the stay apparatus, and in the forelimb, like with Sharon's dissections, she talks about the biceps brachii actually also locking over the humerus on the medial aspect. So it's not such an obvious locking mechanism as with the patella because obviously the forelimb should always be straight, but that it basically should kind of have its natural position there, helping to keep that leg straight. And when you're looking at the stay apparatus, you know, like the tricep runs from the back of the scapula to the elbow, it enables the bones of the forelimb to stay in the angles. So specifically, like the humerus is on a bit of a oblique inclination or oblique angle to the scapula, like it forms about a 90-degree angle at the shoulder. And so it means that that humerus stays in that position. And if you say cut the triceps, like the humerus is not going to the elbow's going to drop down, for example. So it keeps the elbow in the position because the humerus is maintained on that angle. Um, Also with your check ligament, so you've got the superior check ligament, which comes to the superficial digital flexor, and then the inferior check ligament, which often people are more familiar with because that's the one that sometimes they cut with chronic laminitis, and it goes to the deep digital flexor tendon. So we also have to recognize that all of the tendons in the lower limb have muscles attached to them, and that those muscles which go up the leg or come down the leg are part of the stay apparatus. So, you know, once you've got a tendon injury in a horse, you've got a compromised stay apparatus. And, you know, even once your scapula is not able to move correctly, which happens in a lot of cases with saddle fit thoracic sling function, like you're compromising this stay apparatus. And so it's probably more common than we even recognize that the horse's stay apparatus is not working to 100%, you know, effectiveness and efficiency, because every time that that load is altered a little bit, so whether it's the change in tension of the forelimb's then being pulled in a slightly different position, so it's not quite vertical, you know, every little bit that that's not in alignment, there's a compromise to that stay apparatus, and there's an increase in energy required for the horse just to stand. Horses are designed to be able to efficiently stand and utilize minimal energy in that situation, whereas why we do the whole equine functional posture course is because there's a lot of horses that are not standing in an efficient posture, which means that their system is constantly having some degree of muscle tension, which requires energy, which over time fatigues, and then horses just, you know, they're either a bit more jumpy, a bit more reactive, or, you know, they just can't perform to their maximal capabilities because they're always using energy when they shouldn't need to utilize much to stand. Standing should be a comfortable, safe, easy position for the horse. Much more easier than it is for us.
There's also, it's quite common to find horses with shoulder area tension in different levels, or less tension than there should be. So the muscles are kind of flaccid and jelly-like in different spots. And so it's often it's confusing sometimes, especially when you're like, why does this feel different? You're starting to notice your horse's tension. You're like, why is this area always tight? Why is this area not tight? And like you were saying, the limb is supposed to stack straight underneath the body, but it's quite common to see horses that are a little bit tipped forward, or that will adjust to sort of put one leg out to the side, or they just are standing offset. And so if you're functioning differently, then your structure, so the standing level of tension or the fibers being reinforced to a certain level through all of that tissue is going to change, and then it becomes more permanent in the long term, or more static. It's not able to stretch out and lengthen. So you're getting this loop of change.
Yeah, and then you end up, like you said, well, then if you can't stretch and lengthen, it ends up having a significant influence on your stride efficiency as well, or your ability to stretch out in a gallop if you're a racehorse, or your ability to lift the limbs and then land on a jump. So this is why posture is so important because
So important.
it influences every part of your horse's motion. So there's some other anatomical connections. So we've talked about like the main muscles and tendons involved in it, and I also just go back there a little bit with the muscles and tendons that we had talked about. Like there's a balance from the front to the back of the leg. So like we've got triceps and biceps, flexors and extensors. Like it's that whole balance that keeps the limb in the column. But then we mentioned fascia. So you mentioned like the balance of fascial tension being very important. Do you want to just talk about those fascial lines because they kind of connect the stay apparatus, to the rest of the body. So if there's tension somewhere else that's not in the stay apparatus, for example, we'll just use the example of the pecs, that's going to influence the function of that stay apparatus. So do you want to just explore that a bit more?
So there's four forelimb fascial lines, as defined by the myofascial lines book. And so you've got the protraction and retraction. So protraction means like to bring something forward. Retraction means to bring something back. So the protraction line is on the front side, retraction on the back side, and you also have adduction and abduction. Adduction, adding, means bringing like closer. So when the limb swings in as if it's coming in underneath the body, and then abduction as if it's coming off the body, like out towards the side. And so there's those four lines. And so the protraction line, the forward line, comes all the way from the occiput, so the skull at the top of the skull, and then it comes down the neck through brachiocephalic and omotransversarius. It goes up across the front of the shoulder, up to almost where the withers are, the trapezius and rhomboid. And at that shoulder junction with the brachiocephalic and omotransversarius, it then goes down the front of the leg through that biceps, brachii, lucertus, fibrosus, and the extensor muscles all the way down to the front tip of the hoof.
So there's a connection there with that line from the head to the hoof.
Yeah. And then up to the withers as well, like up to the whole space. And then on the side you have your forelimb retraction line. So, and this muscle, this fascial line begins with the deep fascia of the upper neck, and it comes across the top of the neck back towards the wither, and then has a connection into the trapezius and rhomboid again. And then it comes down the infraspinatus, which is on sort of the back half of the scapula. And then from there, it comes down through that thoracolumbar fascia, which it stretches all the way from the lumbar right down into the inside of the humerus in between the shoulder and the elbow. And then it then goes down the back of the leg through all of the flexors all the way back down into the back of the foot. So when you consider, that's reached from the upper half of the neck, deep as well, those deep connections in the upper neck. It then comes back to match up with tissues that reach all the way across the horse's back. The thoracolumbar fascia is a very big structure, down in through the back of the leg all the way down to the foot. So if you have dysfunction in one of those structures or in a relative structure, then you're going to be having an influence on that line as well.
Which means that, saddle fit is integral for stay apparatus function, apart from what it physically does to scapular motion, but also like the thoracolumbar fascia, you're sitting the saddle on there, and the way that we ride the horse is going to influence how they can utilize those forelimbs.
And because you've got those neck connections as well, it's another reason to think about the fact that the head and neck is a representation of how the body is functioning. But if you manipulate the upper neck, like you over control it in movement, roll her, or even lightly, because fascia is so sensitive, if you are over controlling the head and the neck, then you're going to have an influence in your forelimb motion as well. And then you've got, so we're talking about those are your forelimb protraction and retraction lines. And then you've got your adduction and abduction lines. So if you look at the abduction line, taking it off the body, it has a lot to do with scapular function. It includes the trapezius at the top near the wither, deltoid, which comes down the outside of the shoulder, back into that biceps brachii, and then it wraps around on the inside of the leg. And so it includes the pectorals, and then it comes back out again. So it's kind of doing a loop. It starts at the wither, comes down across the shoulder, comes into where the sternum is, and then it travels backwards a little bit and then almost comes back superficially again through the latissimus dorsi and the trapezius. So it's doing like an inside loop around the leg to allow it to lift off the body. And then you have your adduction line, so bringing it towards the body, and that is another loop around the scapula again. So it begins at the subclavius, which is kind of the muscle at the front of the shoulder that often you can feel the muscle there as you run your hand down the front of the shoulder, and then it comes in to the sternum through the pectorals again. And then it comes around and connects to supraspinatus, which is the muscle at the sort of the front of the scapula, and teres major, which is another muscle sort of along the line of the triceps. And then it comes all the way back up to those rhomboids and loops around and attaches back at the same point where it started at the subclavius. So that gives you control away and towards the body. And the balance between those lines is very important because they control limb position right before landing. And so that's very integral for the stay apparatus. So they control the internal external rotation of the forelimb. And so how the hoof lands is going to have an impact coming up the limb, both concussive, but also on the structures, the extensors, flexors, and all the way up through the shoulder. So the ability for the foot to land and for everything to be well stacked, able to absorb concussion in the bony structures, the tendons, and also your muscles, all the way up to the spine, prevents the collapse when you load. And there's a lot of force coming through. Like the studies have shown that it's multiple tons of pressure coming through one limb, through the leading limb at a gallop takes. It's like a few ton. I can't remember. I want to say 4, but it could be a bit less than that. It's multiple ton of pressure coming down through that leg. So, yeah, a lot.
It really, and it highlights the ability for that forelimb to be free. So, I mentioned saddle fit as being integral for the motion of the forelimb, but also girth position, like you mentioned, latissimus dorsi and pectorals involved in those fascial lines, and then how they're going to influence the stay apparatus. And so if you've got girth tension, girth discomfort, girth pull, that's going to influence how that limb is moves through its motion and then how it's loaded. But also, going back up like through the brachiocephalicus and the head and neck position that you mentioned, it comes also to bit comfort and where that head and neck position is, because that's going to have a massive influence on their ability to extend through the shoulder. For instance, if they're a bit tucked in their head and neck, they're going to lose that ability for the forelimb to go through a full range of motion in protraction, so going forward. And so then you've changed the movement through the air, which means you're going to change the stance phase and the strength of that leg as it comes into position. So there's a lot of influencing factors there. And then you've got the hoof as an influencing factor itself in terms of whether it's shod or barefoot or balanced or not balanced or comfortable. And so they're going to have a massive impact on this stay apparatus. So you can, the stay apparatus keeps it stable, but then you've got influences from either end that are going to also determine its function. So, Mooney, one of my off the track thoroughbreds, when he first came to me, he buckled at the knee, in his left fore, I think, from memory. And initially I was still learning a lot back then when I got him. And I was like, geez, like, does he have a sore carpus? But I was like, no, his carpus flexes normally. There's no obvious swelling. There's no thickening of the joint capsule there. He feels okay. He doesn't react to the carpus. So, because that can be a cause, right? Like if they've got knee pain, carpal pain, then they might not want to load it properly. And so they buckle it. So he was buckling at the knee. He struggled to lift up all his feet, I think, from memory. So, but then one thing he had was a massive hole in his pecs. Like it's obvious. He still has it today. It's a big hole in his chest on that side. And so I worked with him with variable feeding positions and he's never buckled in that knee since. But you imagine riding that, he can't stabilize when he's standing, let alone you're then going to ask him to stabilize when he's moving or land at a jump. That would be even worse. Now, sometimes they can get away with it in movement because they're going quicker. So they can utilize momentum so that, but you will see it sometimes if you video a horse or you take a photo at a specific moment when the leg is coming into weight bearing, sometimes you can see it where there's like the front leg should, get to a position where it stays straight through that as it comes into the landing phase, all through the landing phase, and then as it pushes off. But you'll see some horses where the knee bends a little bit. That's not a healthy stay apparatus. If you see that the knee is bending, like obviously as they then bring it through the swing phase, it's gonna flex. But it's when it flexes when it should be straight. And that's any part of that stance phase, the anticipation of landing, it should be ready, straight. Comes through, hits the first point of landing, straight. Hits the middle of the landing, straight. Enters into that backwards phase, it's still straight as it pushes off the ground and then it flexes. And you'll see horses where they're pushing off the ground and the knee's already bending, and there's a problem there.
So you're saying the wobble shows up in the moments before the foot has contacted the ground or when it's contacted the ground?
Well, it could show up in either, but I think it's easier for people to see when it's contacted the ground, that the knee is not perfectly straight. Yeah.
And what other sort of dysfunctions do you see or symptoms that either come up that people complain about and you're like, okay, yep, that clicks. I'm gonna look at I'm gonna look at the stay apparatus, or that you see when things have become compromised?
Yeah, stumbling or tripping, like it'll be on the list there's lots of things on the list for stumbling and tripping, but you'd be like, well, why can't they, bring the leg forward appropriately? Or are they stumbling or tripping, or is the leg giving way at a certain point? I'd be looking at their thoracic sling for any restrictions and weakness. If they've got a weak thoracic sling, they're probably struggling with their stay apparatus. And if they've got, any dysfunction within that limb, like I look at how horses can abduct, adduct, protract, retract. Any restrictions in that motion is going to influence the stay apparatus. But, I have done a lot of dissections of lower limbs, and in that, there's always a lot of subclinical damage to the tendons. Sometimes in the accessory carpal area, there'll be inflammation in the check ligament attachments. And so I think there's a lot of strain that happens subclinically that's like stressing that stay apparatus that is not recognized, which is why it's so important to look after your horse's tendons. Don't overheat them, don't put boots on them unless it's for physical protection, like ice them after any hard work. Like look after those tendons, they're your horse's stability, as well as looking after their postural function for the upper body stability to reduce the load that's going through their legs. I think the other biggest dysfunction that you see is when people are trimming. And I've had a few trimmers say to me, um, oh, the stay apparatus is not working properly because they feel like the horse is unstable. It feels like the horse is going to fall on them. It's very unsafe for a hoof care professional to be under a horse that doesn't have an appropriately working stay apparatus. It's like a hoof care practitioner's, worst nightmare is to be under those horses because they're unpredictable. I've had it happen. I've been riding Jelly. It's happened twice since over the time that I've had him, where in hindsight he was tight in his neck at the time. Um, but his leg has given way on him, and it's always the same leg. It's his right front leg, which I believe he has some rib stuff pathology in there. Like he always gets the same restriction in that right rib caudal neck area. And twice it's happened where, yeah, he's weight bet on that leg and it's dropped, and it's nearly dropped us both to the ground because he couldn't anticipate it. I couldn't anticipate it. Thankfully, both times we'd done enough postural work and body awareness that he picked us both up. Because one of the times we would have been on the ground, like I don't even know how he actually slipped that time. Yeah, he slipped, and I think his stay apparatus gave way. So, and I know other people who've been on horses like that where they're cantering and then, whether it's a nerve impingement, like a brachial plexus nerve impingement, and the front leg has landed and collapsed. And so it becomes extremely dangerous if you're cantering and jumping, because that's when you're relying on a pogo stick action of the front leg. If that gives away, you and your horse can very quickly be on the ground. So, yeah, it's a very, very big safety consideration.
Yeah. And I mean, I've seen a couple of horses for bodywork sessions where, people have had it dismissed to them when their horse has kind of gone down a bit on the forelimbs because they're lazy. But nobody wants to fall. Nobody is so lazy that they would fall on their own
They're
face.
exhausted, they're tired,
Yeah,
probably.
and things just aren't functioning. They've spent too long in the sand as well as on top of being compromised. So if anybody tries to tell you that that's simply because of laziness, we're here to tell you it's definitely not. And you need to get to the bottom of why that is for safety reasons, but also comfort. Because even if it's not, say, a structure in the forelimb, like your knee, then as you suffer the consequences of things like falling on them, you might end up with issues there.
Yeah, and horses' front legs shouldn't wobble when they're standing. So if you can easily like touch their leg, like if you can kind of push at the back of the knee and your horse's leg wobbles, that is not
Yeah.
normal. Like if you gently push at the back of the knee, it should be a solid structure there. And so it's pretty easy to kind of test that stay apparatus by just kind of pushing at the back of the knee and seeing are they solid in that area. Another thing that I look for is, when I do the wither rock, the forelimbs should stay straight in their stabilization. So, as they're weight shifting from side to side, the forelimb should be able to take the weight and stay straight. But what you'll see sometimes if there's a pull, maybe it's fascia, you know, some kind of restriction there, you might see a rotation happening in the leg, or it won't take the weight. So it reluctant to take that weight, then there's something going on there that's compromising or uncomfortable. Or they bend in it. When you put the weight onto the leg, you see like they actually bend the leg somewhere. So all of those like three things tests that you can do. So at the back of the knee, weight shifting, and also just looking at, especially when you're also standing for the trimmer, just have a look at the other front leg. Like, is
And
it
I would,
locked up? Is it
is it,
straight? Does it look
yeah.
stable?
And I do think you can see a little bit of it when you ask your horse to pick up their foot. Like, do they kind of clunk out of stability on the leg that you're asking to pick up? I think, especially when you ask at the chestnut, like on the inside of the knee
Well, that's a superior check ligament right there.
as well. And they just pop out of it. Like they just kind of like, oh, it's not well locked. And I just remembered I scared myself once because I thought, oh, this horse's stay apparatus doesn't look that good. I might just do what you said, put her on the back of the knee. And she was so unstable that she nearly fell on me.
Yeah.
Like it was like she was obviously trying to stay up, and all it took from me was a little like, "Oop," and I was like, oh crap, don't fall, you know.
That's why the chestnut works well for people to pick up the legs, and
Yeah,
I don't recommend it because it's basically affecting that superior check ligament and unlocking the stay apparatus.
yeah,
Um, so when we squeeze in there, that's, that's what's happening.
yeah, yeah.
So
So
what are some of the causes of stay apparatus dysfunction?
one, sleep deprivation. I think that is, yeah, something that's very unfortunate when you have a horse who won't lay down to sleep and they end up very fatigued. So you talked about that muscle fatigue before when it isn't functioning well, when it isn't able to hold them up, then you have a collapse. And so you see horses actually they'll be standing and maybe they've kind of dozed off and then their knee will buckle and you see them they have injuries on the front of their fetlock because they've been collapsing either for a long time and then they end up with kind of like a long-term wound there. Um, Sometimes when they're fully collapsing, but do you have any other comments on sleep deprivation?
No, I think it's probably a whole thing we could talk about as a separate.
Like an episode in
Yeah, we
itself.
might do an episode on it because I think it's a really important thing to recognize. And um, I think it can be cause and effect with the stay apparatus, like sleep deprivation can lead to stay apparatus fatigue, and so then they collapse. And then stay apparatus fatigue or stay apparatus dysfunction may be a contributor to sleep deprivation if, they're struggling to get up or down. So, um, yeah,
I
I
suppose
think
you don't sleep very well even standing up. Like there's a level of rest horses get
exactly.
standing up. If you
You
if you're
cannot.
never able to switch off, then that's a level of fatigue as well.
Yeah, definitely.
Hoof pain or imbalance is another one. So having heel pain, if you're adjusting the balance of your foot, like you're changing the angle yourself, or you're trying to offload a structure, like you're kind of offloading that limb, then you're not stacking it properly, which becomes self-reinforcing again. Pectoral damage, like you spoke about with Mooney, that's a good one, especially because they're tissues that do get damaged quite a lot in horses. Joint pain, like offloading a sore carpus, nerve dysfunction. Did you have any comments about horses you've seen or anything like that with the
Yeah, so like
neurological?
I had a horse that I saw at a clinic and her posture, she was very camped under in front and behind and very wide in front and behind. And at the clinic, her trimmer was there. And when I tested her neurologically, she failed the test. So she showed up as being neurologically unstable. And the trimmer said, "Oh God, like I'm so scared of trimming this horse all the time because she feels like she could fall on me at any moment." And she's not aware either because she doesn't want to be in her unsafe, wobbly body. So, neurological dysfunction is always something to consider, like whether they have a malformation in the cervical vertebrae and it's causing nerve compression, whether they're like a wobbler and there's a nerve compression, somewhere else in their neck from a narrowing of the spinal canal. Um, or they're getting some kind of nerve impingement from the brachial plexus, like, which can come from birth trauma. It can come from foals. Like I've seen foals that really struggle. I think we mentioned it, like picking up their forelimbs. Their stay apparatus is compromised if they've got rib trauma. So when a foal is not being easy to trim, we need to consider what's going on there. So yeah, and as soon as we helped that mare to stand in a better posture, so over a couple of days, we put a T-touch wrap on her. We worked very slowly with walk and body awareness. She was stable. Like her stability had improved a lot, and her awareness, presence. And the trimmer would always put a T-touch wrap on her after that to help her with the trim. And yeah, she was much, much more stable after that. So it's really important that you consider neurological function.
Yeah. Also, postural compensation. So if you're, like we talked about with the fascial lines, how other parts of the body can be influencing your forelimb itself through direct anatomical connections or fascial connections, which, something can be very far away. So if you have something like the latissimus dorsi, which becomes the thoracolumbar fascia, if that is very dysfunctional, whether it's super tight or something's going on, then you are going to have a change in the pull on the humerus, which might change the alignment of the elbow. And then if you don't have the ability for those structures to properly lock out, then you're going to have a dysfunction in that space. So being aware that there can be a dysfunction in one of the structures, or you can have a postural issue somewhere else. So you might have an injury of one of the structures we mentioned is the stay apparatus, or you have an issue coming from somewhere else.
Yeah, I've really seen this with Ellie because I think there's been a number of injuries that she's had to her right forelimb, and so it has become a bit externally rotated. And I remember like she was straight when I first got her in her forelimbs, but then all of a sudden, and we had a dam at the old place, so whether she kind of got a bit stuck in the dam, but she started really throwing her legs out and having quite a lot of paddle. And I believe that she damaged under her scapula. Um, and so there's been a rotation in there. So then when I do the with a weight shift, her leg rotates outwards. And also for the trimmer, she doesn't like bringing that leg forward. And she'll often react, and go to kind of rear in those situations. So that can be another indicator of dysfunction. If the horse, especially when the leg goes forward, they might go to rear, or when they take the leg back, like into a farrow position, that's often when the horse will fall or drop because of the pull into the brachial plexus area. So, or they take the leg outwards away from the body and the horse starts to, pull back and react. So yeah, Ellie's had quite compromised through those, especially her right forelimb stay apparatus.
Yeah. So if we think about consequences, I mean, we've talked about them, really just mentioning them when you talk about what plagues what you're kind of seeing show up in sessions, trimming, etc. They really come under sleep deprivation that we talked about from both directions, the stay apparatus influencing sleep and sleep influencing stay apparatus. You've also got falls during hoof care, safety issues for you and the horse when you're being ridden. I honestly think at all levels, even at a walk, if your horse falls, you're in trouble.
Yeah.
As well as long-term postural and structural changes, because structure and function are interrelated. When you're functioning in a certain way, the tissue reflects that function. And so that's a structural change, which is ideal to get ahead of as soon as possible. And that's why body work and postural training or postural work is so important, because you're actually you're encouraging function in a different way, which means that the structure begins to reflect that function. And we want the structures, the muscles, the tendons, the joints, the bone, everything to be as ideal for that horse as possible.
Yeah, I think it's really important that if your horse has a stay apparatus weakness in standing, you really need to consider the risk of riding that horse.
Yeah.
Because, yeah, maybe, 9 times out of 10, the horse doesn't fall, but then the 10th time they do. So, you just have to recognize that when you're riding a horse that has a a buckling in standing or a weakness in supporting the limb when standing, that you have an increased risk of injury for yourself and the horse in those situations.
And
So
what would you tell people that they can do? What would you be the first step?
come do the equine functional posture course. Address the underlying postural deviations and create a functional posture for your horse. I think that's the best thing that we can do for horse welfare in so many
Yeah.
ways, is the better they have a functional static posture going into a functional dynamic posture, and figuring out if our horse doesn't, why they don't. Like, what's the problem here? Where do I need to address?
Yeah. And I think it's worth saying too that horses, let's say you have a tendon injury and your stay apparatus kind of starts falling apart, there's a possibility that your horse, if they'd had fantastic posture before an injury, one probably wouldn't have got the injury because most injuries come from overuse, but also their compensation would not have been to the level where they're compromised. They may have just had an offloading or a change in pattern, but it's not to the point where they've become unstable. So if you can get ahead of that by having good posture, you're always in better stead to recover from things and not have them go catastrophic.
Yeah, definitely. And if your horse does have it, then investigate what the underlying cause of it is. Hoof comfort and balance is really important for the stay apparatus, as is the thoracic sling and the function of all the associated muscles. Surefoot pads can be really beneficial too for improving stay apparatus function and stability. So, like Wendy Murdoch, she has the variety of Surefoot pads, and you need to be aware about how to apply them, but they're definitely beneficial for horses that are lacking stay apparatus function, as are the T-touch wraps, like knowing how to apply them in a figure of eight or even just around the front end, sometimes on the limbs, can be really beneficial for helping with limb stability.
And as you said, variable feeding positions, which are in the EFP course, to get that balanced square stance.
Yeah,
So
and
your
it's
horse
always
can,
looking for your horse to have optimal loading through each leg,
yeah,
um, is super important. That they're not overloading the front legs, especially because that's pretty common. And looking for those vertical alignment of the limbs relative to the hips and shoulders,
yeah.
is really beneficial.
My
So,
takeaway is check the
yeah,
wobble. You got to check the wobble. We're gonna that's a good saying for Forelimb. Check the wobble, check your stay apparatus.
yeah, definitely. And just recognize those compensatory postures.
Wonderful.
Awesome.
Okay, well, a last thank you for our sponsor. The support for this podcast comes from Dr. Shelley Appleton of Calm, Willing, Confident Horses, providing clear, grounded guidance to help horse owners get unstuck with a whole horse view of behavior, learning, and well-being. Details are in the show notes.
Awesome. Thanks, Shelley. Okay, thank you for joining Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. And reach out with any listener requests or sponsorship opportunities, and topics that you'd like us to talk about.
And we'll see you in the next exciting episode.